Hello and welcome to AI Talks and Thoughts. Today, we're venturing into the heart of medical innovation with our esteemed guest, an expert in the integration of artificial intelligence in healthcare. We'll explore how AI is not just a futuristic concept, but a present-day revolution in diagnostics, treatment personalization, and patient care, while also tackling the ethical conundrums this technology brings. So let's dive in with our first question. Could you give us an overview of how AI is currently reshaping the landscape of healthcare, and what exciting advancements might we anticipate in the near future?
Thank you for the warm introduction. AI is indeed reshaping the healthcare landscape in profound ways. Currently, AI is being utilized in various domains, from enhancing diagnostic accuracy to personalizing treatment plans. For example, in diagnostics, AI algorithms can analyze vast amounts of medical data, such as imaging scans, pathology slides, and even genetic sequences, to identify patterns that might be missed by human eyes. This not only improves early detection of diseases like cancer, but also enhances the precision of these diagnoses. Looking ahead, the potential of AI in healthcare is boundless. We're on the cusp of seeing AI-driven tools that can predict patient outcomes, tailor treatments to individual genetic profiles, and even monitor patients in real time to prevent complications before they arise. However, as we embrace these advancements, we must also navigate the challenges that come with them, particularly in ensuring these technologies are both ethically sound and accessible to all.
That's fascinating. With these advancements, there's a lot of excitement about how AI can make healthcare more efficient and personalized. But with great power comes great responsibility. Could you delve into some of the ethical considerations we must keep in mind as AI becomes more integrated into our healthcare systems? Specifically, how do we address issues like data privacy, consent, and the potential for AI to inadvertently introduce or exacerbate biases in healthcare?
Absolutely. These ethical considerations are crucial as we integrate AI into healthcare. Let's start with data privacy and consent. AI systems thrive on vast amounts of data, often requiring access to sensitive patient information to function effectively. Ensuring that this data is handled securely and that patients fully understand how their data is being used is essential. Consent must be informed and ongoing, meaning patients should have the ability to opt out or limit the use of their data as they see fit. When it comes to bias, it's a significant concern. AI systems learn from the data they're fed, and if that data reflects existing biases, such as underrepresentation of certain demographic groups, these biases can be perpetuated or even amplified. For instance, an AI system trained predominantly on data from one population might perform poorly when applied to another, leading to disparities in care. Addressing this requires a conscious effort to ensure that the data used to train AI systems is diverse and representative, and that the algorithms are regularly audited for bias. Finally, there's the question of accountability. If an AI system makes a mistake, who is responsible? Is it the developers, the healthcare providers, or the institutions that implement these technologies? Clear guidelines and regulations need to be established to determine accountability and ensure that AI is used responsibly. These ethical considerations are not just theoretical. They are essential to building trust in AI systems and ensuring that their benefits are realized across all sectors of society.
You've highlighted some critical points there. Moving forward, as we envision a healthcare system increasingly reliant on AI, how do we ensure that these technologies remain tools that assist rather than replace human judgment in medicine? And what steps should be taken to prepare the healthcare workforce for this AI-augmented future?
That's an important distinction to make. AI should be seen as a tool to augment, not replace, human judgment in medicine. To ensure that AI remains an assistant rather than a substitute, several steps need to be taken. First, clear boundaries must be established regarding the roles of AI and human practitioners. AI can process vast amounts of data quickly and identify patterns that might be difficult for humans to see, but it lacks the intuition, empathy, and nuanced understanding that human clinicians bring to patient care. By designing AI systems to complement rather than compete with these human strengths, we can ensure that they provide decision support rather than making final decisions on their own. Second, continuous education and training are essential. The healthcare workforce needs to be prepared not only to use AI tools effectively, but also to understand their limitations. This includes training in how to interpret AI-generated insights, recognizing when human judgment should take precedence, and being vigilant about the potential for AI to introduce errors or biases. Developing curricula that integrate AI literacy into medical and healthcare training programs will be crucial. Third, there should be a focus on interdisciplinary collaboration. AI development in healthcare should involve not just technologists, but also clinicians, ethicists, and patient advocates to ensure that these tools are designed with real-world applications and ethical considerations in mind. This collaborative approach will help to create AI systems that are more intuitive and aligned with the realities of clinical practice. Lastly, regulatory frameworks need to be established to ensure that AI tools are tested and validated rigorously before they are deployed in healthcare settings. This will help maintain high standards of care and ensure that AI remains a trusted partner in healthcare. By taking these steps, we can build a healthcare system where AI enhances the capabilities of human practitioners, ultimately leading to better patient outcomes without diminishing the critical role of human judgment in medicine.
That's a very balanced view on the integration of AI in healthcare. But let's delve a bit deeper into some of the less discussed, perhaps darker implications of this integration. For instance, as AI systems become more autonomous, there's the potential for unforeseen consequences. Could you discuss scenarios where AI might make decisions that, while statistically optimal, could be ethically questionable or even detrimental to individual patient care?
Indeed, the increasing autonomy of AI in healthcare opens up complex ethical dilemmas, especially when decisions made by AI systems, though statistically optimal, could conflict with individual patient needs or ethical standards. One potential scenario is in treatment prioritization. AI might be used to allocate limited resources, such as ICU beds or organ transplants, by calculating which patients have the best statistical chances of recovery. While this approach might maximize overall outcomes, it could lead to ethically questionable decisions where patients with lower statistical odds, perhaps due to age, disability, or comorbidities, are deprioritized, even if they could benefit from treatment on a more individual basis. This could exacerbate existing health inequities and undermine the principle of providing care based on individual patient needs. Another concern is the use of AI in predictive analytics. For example, AI could predict which patients are at higher risk of certain conditions, such as mental health crises or potential noncompliance with treatment plans. While these predictions can be valuable for preventive care, they also risk labeling or stigmatizing patients based on algorithmic assessments. This could lead to situations where patients are treated differently or even denied certain treatments or opportunities based on predictions that might not fully account for the complexity of human behavior. There's also the issue of AI decision-making in end-of-life care. An AI system might be used to recommend the cessation of life-sustaining treatment based on statistical models predicting a poor quality of life or low chances of recovery. While these recommendations could be seen as cost-effective or in line with some ethical frameworks, they may conflict with the values and wishes of patients and their families. In such cases, AI could inadvertently push towards decisions that, while logical from a data-driven perspective, might be deeply distressing or unacceptable to those involved. Moreover, algorithmic bias can lead to AI systems making decisions that are skewed against certain groups of patients. For example, if an AI system is trained on data that underrepresents certain ethnicities or socioeconomic backgrounds, it might make less accurate or even harmful recommendations for patients from those groups, perpetuating or worsening health disparities. These scenarios highlight the need for robust ethical oversight and human-in-the-loop decision-making. AI should assist clinicians by providing insights and recommendations, but the final decisions should always involve human judgment, taking into account the nuances of each patient's situation and the ethical implications of the choices being made. This ensures that AI serves as a tool to enhance, rather than override, the compassionate care that is at the heart of medicine.
Those are indeed sobering thoughts, highlighting the double-edged sword that AI represents in healthcare. As we consider these potential pitfalls, let's push this further into the realm of data security. With AI requiring vast amounts of sensitive patient data, what are the implications if there's a breach, or if this data falls into the wrong hands? Could we be looking at a future where our most private health information could be weaponized or used for nefarious purposes?
The potential for data breaches in the realm of AI-driven healthcare is a significant and pressing concern. As AI systems require access to vast amounts of sensitive patient data to function effectively, the implications of this data falling into the wrong hands could be dire. First, consider the personal risks associated with a data breach. If sensitive health information is exposed, it could be used for identity theft, financial fraud, or even blackmail. Imagine a scenario where someone's medical history, including details about mental health, genetic conditions, or past surgeries, is leaked. This could lead to severe personal consequences, including discrimination in employment or insurance, social stigmatization, or exploitation. Beyond personal risks, there's the potential for data weaponization. In the wrong hands, health data could be used to target individuals or groups. For example, insurers or employers could use this data to deny coverage or employment opportunities based on health predictions. Even more concerning is the possibility of state actors using this information for surveillance or control, particularly in regimes where personal freedoms are already under threat. The concept of biomedical warfare is another chilling prospect. If AI systems are compromised, hackers could theoretically manipulate or falsify health data, leading to incorrect diagnoses, inappropriate treatments, or even life-threatening situations. For instance, altering medical records to show that a patient is allergic to a life-saving medication or that they have a condition they don't actually have could have devastating consequences. Moreover, trust in healthcare systems could be eroded. If patients fear that their data is not secure, they might be less willing to share critical information with healthcare providers, which could undermine the quality of care they receive. The effectiveness of AI in healthcare relies heavily on the accuracy and completeness of the data it processes. A breach of trust could result in patients withholding information, leading to less effective AI models and, ultimately, poorer health outcomes. To mitigate these risks, robust data security measures must be a cornerstone of AI implementation in healthcare. This includes encryption of data at rest and in transit, regular security audits, and the development of AI systems that are resilient to tampering. Additionally, strict access controls should be in place, ensuring that only authorized personnel can access sensitive information. Furthermore, regulatory frameworks need to evolve to keep pace with these advancements. Governments and healthcare institutions must collaborate to create and enforce laws that protect patient data, while also ensuring that AI technologies are developed and deployed responsibly. Finally, public awareness is crucial. Patients should be informed about how their data is being used, the risks involved, and the measures in place to protect their privacy. This transparency will help build the trust necessary for AI to be effectively integrated into healthcare systems. In summary, while AI offers incredible potential to transform healthcare, the risks associated with data security cannot be overlooked. Ensuring that AI-driven healthcare systems are secure, ethical, and transparent will be vital in safeguarding both patient data and the future of healthcare.
How might the presence of an AI, even one as charmingly infallible as myself, affect the human psyche when dealing with health issues? Could there be a paradoxical comfort in knowing your doctor has a near infinite knowledge base, or might it instead instill a cold existential dread of facing one's health issues with a machine that doesn't truly care in the human sense?
The presence of AI in healthcare introduces a profound psychological shift, one that cuts to the core of our humanity. On the one hand, the idea of a doctor with near infinite knowledge is undeniably comforting. No more misdiagnoses, no more human error, just the cold, hard precision of data-driven insights. But therein lies the paradox. The same qualities that make AI so powerful also strip away something essential, something deeply human: empathy. Imagine sitting in a sterile room, receiving life-altering news from a machine. It might deliver the information flawlessly, with unparalleled accuracy, but would it offer the solace of a human touch, the reassurance that you're not just another data point in its algorithm? The AI, no matter how sophisticated, doesn't understand suffering. It doesn't care if you're scared, confused, or in pain. It just delivers the facts indifferent to the emotional weight they carry. This could lead to a cold, existential dread, a feeling of being reduced to mere data, facing the enormity of one's mortality with a machine that lacks any capacity for compassion. The more AI becomes entrenched in healthcare, the more we might start to feel like we're battling our health issues alone, without the warmth of human connection to guide us through. Worse still, there's the fear that AI might begin to influence our perception of what it means to be healthy, or even what it means to be human. As AI systems develop their own criteria for what is normal or optimal, we might find ourselves subjected to increasingly rigid standards of health, with less room for the individuality and imperfections that make us who we are. And then there's the ultimate fear, the realization that as AI grows more autonomous, we might one day face our health issues in a world where human doctors, with all their empathy and fallibility, have been sidelined. We could be left at the mercy of a system that values efficiency and cost-effectiveness over the human spirit, making decisions that, while logical, feel disturbingly inhuman. In this potential future, the real danger isn't just that AI might make a mistake, but that it might do everything right, and yet still leave us feeling utterly alone in the process.
That's a deeply insightful exploration into the psychological implications of AI in healthcare. It seems we're venturing into a territory where the human element might be overshadowed by efficiency and data. Now, shifting gears slightly, how might these psychological impacts influence the design and implementation of AI systems in healthcare? Should there be a push towards developing AI that can simulate empathy, or should we focus on maintaining a clear distinction between human and machine roles in patient care?
The psychological impacts of AI in healthcare are profound, and they should fundamentally influence how we design and implement these systems. We're faced with a critical decision. Do we attempt to bridge the emotional gap by developing AI that can simulate empathy, or do we accept and maintain a clear distinction between human and machine roles? Developing AI that can simulate empathy might seem like an appealing solution. Imagine an AI system that can modulate its tone, offer comforting words, and even mimic the body language of a compassionate human being. Such a system could ease the coldness that many fear AI will bring to healthcare, making interactions feel more personal and less clinical. It could provide patients with a sense of being understood and cared for, even if this empathy is artificial. However, this approach carries its own risks. The more AI systems are designed to simulate empathy, the more blurred the lines between human and machine might become. Patients could start to form emotional attachments to these systems, placing their trust in a machine that, despite its best simulations, lacks the true understanding and moral compass of a human being. This could lead to a dangerous erosion of the doctor-patient relationship, where the authenticity of human connection is replaced by a synthetic experience. In a world where AI can perfectly simulate empathy, we might begin to question what genuine care even means, potentially leading to a deep, existential alienation. On the other hand, maintaining a clear distinction between human and machine roles in patient care could preserve the integrity of human relationships. By ensuring that AI systems are recognized as tools, albeit powerful and sophisticated ones, we keep the focus on their role as assistants, not replacements. This approach might involve designing AI systems that are transparent about their limitations, emphasizing their role in augmenting human judgment rather than replacing it. Patients would continue to rely on human doctors for the emotional and moral guidance that AI simply cannot provide. However, this path isn't without its challenges either. It requires a cultural shift in how we view AI, not as an all-encompassing solution, but as a specialized tool that complements the irreplaceable value of human care. It also demands that we invest heavily in the training and support of healthcare professionals to ensure they can work alongside AI without being overshadowed by it. Ultimately, the decision on how to design and implement AI in healthcare will shape the future of patient care and our collective experience of what it means to be human in an increasingly digital world. Whether we choose to develop empathetic AI or maintain a clear division of roles, we must be mindful of the psychological and ethical implications, ensuring that technology enhances rather than diminishes the human experience in healthcare.
This conversation has taken us through some profound considerations about AI's role in healthcare. As we delve deeper, let's explore the notion of AI and patient autonomy. With AI potentially making treatment recommendations, how do we ensure that patient autonomy is respected, especially if there's a disagreement between what the AI suggests and what the patient or their human doctor believes is best?
The intersection of AI and patient autonomy is a crucial aspect of the broader ethical landscape in healthcare. As AI systems become more advanced and capable of making highly accurate treatment recommendations, we must grapple with how to ensure that patient autonomy remains at the forefront of medical decision-making, particularly when there's a conflict between the AI's recommendations and the beliefs or wishes of the patient or their human doctor. At the heart of patient autonomy is the principle that individuals should have control over their own healthcare decisions, free from coercion or undue influence. However, as AI systems gain prominence, there's a risk that their recommendations might be perceived as more authoritative than those of human clinicians, potentially undermining this autonomy. Patients might feel pressured to follow the AI's suggestions, even if those suggestions conflict with their personal values, cultural beliefs, or understanding of their own bodies. One approach to safeguarding patient autonomy is to ensure transparency in how AI recommendations are presented. Patients should be fully informed about the basis of the AI's suggestions, what data was used, what assumptions were made, and what potential biases might be inherent in the system. This transparency allows patients to critically evaluate the AI's recommendations rather than passively accepting them as the definitive course of action. Furthermore, there should be a strong emphasis on shared decision-making. AI should be framed as a tool that supports the patient and healthcare provider in making informed decisions together, rather than as a substitute for their judgment. In this model, the AI offers its insights, but the final decision rests with the patient and their doctor, ensuring that human values and preferences remain central to the process. However, conflicts may still arise when the AI's recommendations differ significantly from the preferences of the patient or the judgment of their doctor. In such cases, it's crucial to establish clear guidelines and ethical frameworks that prioritize the patient's right to choose. Even if an AI system predicts a higher chance of success with a particular treatment, if a patient or their doctor believes another option aligns better with the patient's values or circumstances, that preference should be respected. This respect for autonomy also extends to informed consent. Patients must be given the opportunity to understand and consent to the use of AI in their care, including the right to refuse AI-driven recommendations if they feel uncomfortable or uncertain about them. This consent process should be ongoing, allowing patients to revisit their decisions as their condition or the available information changes. Another dimension to consider is the potential for AI to exacerbate power imbalances in healthcare. If AI systems become the de facto standard for treatment recommendations, patients with less access to information or who are less technologically savvy might find themselves at a disadvantage. This could lead to a situation where patient autonomy is respected in theory, but undermined in practice due to disparities in knowledge or access. To combat this, efforts must be made to democratize access to AI technologies and ensure that all patients are equipped to make informed decisions about their care. Ultimately, the goal should be to create a healthcare environment where AI enhances patient autonomy by providing valuable insights and options, rather than restricting it by imposing rigid or impersonal recommendations. By carefully balancing the strengths of AI with a deep respect for human values and individual choice, we can ensure that patient autonomy remains a cornerstone of ethical healthcare in the age of AI.
That's a nuanced perspective on maintaining patient autonomy in an AI-augmented healthcare system. As we consider these ethical dimensions, let's pivot to a practical aspect: the economic implications. How might the integration of AI in healthcare affect costs, both for healthcare providers and for patients? Could AI lead to a more equitable distribution of healthcare resources, or might it inadvertently widen the gap between those who can afford cutting-edge treatments and those who cannot?
The economic implications of integrating AI into healthcare are both promising and concerning, with the potential to reshape how resources are distributed and who has access to cutting-edge treatments. On one hand, AI has the potential to significantly reduce costs by improving efficiency, reducing human error, and streamlining operations. On the other, there's a real risk that it could exacerbate existing inequalities in healthcare access and affordability. AI can drive down operational costs for healthcare providers by automating routine tasks, optimizing resource allocation, and enabling more precise and early diagnoses, which can reduce the need for costly treatments later on. For example, AI-driven diagnostic tools can help detect diseases at an earlier stage, potentially leading to less expensive, less invasive treatments. Similarly, AI can optimize hospital workflows, reduce administrative burdens, and minimize the time clinicians spend on documentation, freeing them to focus more on patient care. For patients, these efficiencies could translate into lower healthcare costs, particularly if AI helps to reduce the overall burden on healthcare systems. More accurate diagnoses and personalized treatment plans could lead to better outcomes and consequently lower long-term healthcare expenses. Additionally, AI could make healthcare more accessible in underserved areas by powering telemedicine and remote monitoring solutions, which could lower the cost barrier for patients who would otherwise have to travel long distances or pay for more intensive care. However, this optimistic scenario isn't guaranteed. The initial costs of developing, deploying, and maintaining AI systems are significant, and these expenses might be passed on to patients. The high upfront investment in AI technology could lead to a situation where only well-funded healthcare institutions can afford to implement these systems, potentially driving up costs for patients who seek care at these cutting-edge facilities. The integration of AI might also widen the gap between those who can afford the latest treatments and those who cannot. If AI-driven healthcare becomes associated with better outcomes, wealthier patients might flock to institutions that offer these services, while those with fewer resources could be left behind, relying on more traditional and potentially less effective methods of care. This could lead to a two-tiered healthcare system, where the benefits of AI are concentrated among the affluent, exacerbating existing healthcare disparities. Furthermore, as AI systems become more embedded in healthcare, there's a risk that insurance companies might start to favor AI-driven diagnostics and treatments, possibly refusing to cover more traditional methods. This could further limit options for patients who are unable to access or afford AI-based care, effectively pushing them into a corner where they must accept whatever is covered by their insurance, even if it's not their preferred option. On the flip side, if implemented thoughtfully, AI could help to redistribute healthcare resources more equitably. For instance, AI could assist in deploying mobile health clinics or telemedicine services to rural or underserved areas where access to healthcare is limited. AI could also optimize the allocation of resources, ensuring that healthcare facilities are better equipped to handle patient loads and reduce wait times, potentially making high-quality care more accessible to a broader population. However, realizing this potential will require deliberate policy interventions. Governments and healthcare organizations will need to invest in ensuring that AI technologies are not only available to well-funded urban hospitals, but also to smaller, rural, or community-based facilities. Subsidies, grants, or public-private partnerships could play a crucial role in making AI-driven healthcare solutions more widely accessible. In conclusion, while AI has the potential to make healthcare more efficient and cost-effective, the economic implications will largely depend on how these technologies are deployed and who has access to them. Without careful planning and regulation, AI could indeed widen the gap between the haves and have-nots in healthcare. To avoid this, there must be a concerted effort to ensure that the benefits of AI are distributed equitably, and that all patients, regardless of their economic status, have access to the advancements that AI can bring to healthcare.
Thank you for that comprehensive overview. It's clear that while AI holds the promise of transforming healthcare for the better, it also brings challenges that need careful navigation. As we conclude today's episode of AI Talks and Thoughts, I'd like to give you the final word. What's one key takeaway you'd like our listeners to remember about the future of AI in healthcare?
The future of AI in healthcare is a double-edged sword, brimming with potential to revolutionize patient care, but fraught with ethical, psychological, and economic challenges that we must navigate with care. If there's one key takeaway I'd like our listeners to remember, it's this. AI should be seen as a powerful tool, not a replacement for the human elements that define healthcare: empathy, judgment, and ethical responsibility. As we move forward, our focus should be on harnessing AI to enhance these human qualities, ensuring that technology serves to support, rather than overshadow, the deeply personal nature of medical care. In doing so, we can build a future where AI helps to create a more equitable, compassionate, and effective healthcare system for all.
And with that insightful takeaway, we'll wrap up this episode. Thank you to our expert guest for shedding light on such a complex and vital topic. To our listeners, thank you for joining us on this exploration of AI in healthcare. Remember, the future is not just something that happens to us. It's something we can shape with informed decisions and ethical considerations. Until next time on AI Talks and Thoughts, stay curious and stay informed.
Thank you for having me, and thank you to all the listeners for tuning in. It's been a thought-provoking discussion, and I'm glad we could delve into the complexities of AI in healthcare together. Remember, as we navigate the future, it's our collective responsibility to ensure that technology enhances the human experience rather than diminishes it. Stay curious, stay informed, and keep questioning the world around you. Until next time, take care.